Our JL Partners polling found that nearly half, 46% of white men, self-censor from making a joke or giving honest but respectful feedback to colleagues because of fears it could affect their careers. That's 11 million men in the UK too scared to speak freely, equivalent to more than 53 million men in the US. It's these shifts in culture which can be so telling. Cleet Weigel has a lot more time to admire the view these days. For 37 years, his days were spent as a senior nurse, overseeing rehabilitation programs.
Yeah, I mean, that's my field, because I had a bunch of years in cardiac rehab, and I took care of patients that had had bypass surgery and were home recovering. So it was a very rewarding setting, both home care and cardiac rehab, because you work with patients that, for the most part, really appreciate what you're doing.
As a medical professional, the culture naturally Cleet adhered to was evidence-led, what treatments will actually work for patients. So when the hospital introduced a diversity initiative, he was curious about its efficacy.
The thing that I remember that really kicked it off for me was the CEO of the hospital has employee does little videos, like 4 or 5 minute videos weekly for the entire hospital on what's going on. And one particular week, they had a consultant there. He said, "What do you recommend for our workforce? What would help them, in terms of resources?" And she said, "Oh, I recommend they read Robin DiAngelo's White Fragility." So I got the book. I actually got the audio version and listened to it, and I was horrified by what I heard. I thought, my gosh, this is the most racist book I've ever heard. She's condemning white people. She's condemning whiteness. Like, whiteness is a trait that dooms you. You can't get rid of it. You must try. You have to repent the rest of your life. And I just thought, this is crazy. I mean, if I really, I thought, this doesn't make sense. And I thought, if this consultant is telling our CEO, your workforce should read this book, it explained my life to me, I'd be horrified if our whole workforce read that book and bought into it. It would destroy any trust we have in one another.
Implicit bias training followed, part of an attempt to address the higher maternal mortality rates amongst black women in the state.
We're a medical facility that treats people and tries to help people based on evidence-based medicine. And what you're doing here is not evidence-based at all. You're presuming that this part of the workforce is racist and biased and probably causing the disparities in health outcomes of these types of patients. And I feel it's a totally erroneous assumption and very destructive. The other thing is, assuming I'm right, then while you're doing all this, you have women who are dying at a higher rate in infants, and you're not really looking for the real cause. You're blaming it on the white people because they don't have the right attitudes and whatever. Yeah, there are many things that contribute to a higher mortality rate, and these are well known. They're not just assumed. Cigarette smoking and poor diet and not taking medications and poverty and instability in the home and lack of transportation and illiteracy and school system. I mean, there's so many disruptive forces in the culture that can cause disparate outcomes that, well, it's much more likely that that's the source of the problem. And it'll be very tough to change those things, but certainly won't change it by talking to the white people and saying, let's fix your implicit bias. what we're going to do is alienate people and destroy communication channels.
When Cleet questioned the DEI training when he asked for data, he was given an ultimatum: do more implicit bias training or lose your job. So he quit.
What does this say to nurses who have been working with these patients 20, 30 years with, I'm sure, a great deal of passion and care and skill? And you're going to turn to them and say, well, we want to explore these hidden biases we think you might have that might be causing disparate outcomes among people of color. It's insulting. It's outrageous.
There's a pattern. Ask for the data that DEI works, and you're a troublemaker. Dorian Abbott, the Chicago geophysicist in episode 2, given a re-education ultimatum, Cleet, in Ohio. Impediments to a righteous path, who just need more training to see the light, rather than the data they yearn for as men of science. In London, Professor Carol Sikora is also a stickler for evidence. A good thing, given his job.
I'm an oncologist. I'm an academic oncology professor and chairman at Imperial College, Hammersmith, Charing Cross and St Mary's in oncology for 25 years. Joined the WHO as Director of Cancer Services for a couple of years on secondment, and then set up a group of cancer centres in the UK and abroad. And that's what I do now, and I carry on working, building cancer centres.
As well as taking time out to go on DEI training.
Every year we have to do one. For my appraisal, we have to do a diversity course. It's the same every year, and it's almost insulting. Everyone realizes what it is. I mean, we joke about it. Vividly remember that she showed a video of an old man sitting on a park bench and some youths around him throwing beer bottles at him, or beer cans, empty beer cans at the old man. And she said, "How do you feel about that?" I said, "Why are you asking us? I mean, obviously it's disgraceful, but, that it happens, And she wasn't content with that. She wanted to say, but what about the ethnic group of the males throwing the can? What's it matter? It doesn't matter whether they're black, white, or yellow. They're doing bad, She was trying to racialize what was clearly nothing to do with race. This seemed so stupid. And I think that's the problem with people in the diversity business. They obviously go away on courses, more advanced courses than I've ever done, I assume, and come up with these rather bizarre ideas that we should learn. And I think most doctors struggle. And it's because I think we're all used to diversity in healthcare. We don't think of it. We don't racialize people. We don't. Rich, poor, it doesn't matter. They're the patient in front of you. You do what you can, the best for them. I think the problem that I have with it is there's no evidence of value for money. What are they actually doing all day? And what they are doing is troubling other people that are trying to do their job, trying to make them think about diversity. So the NHS has enough bureaucracy as it is, and to add another layer with diversity, how can we employ someone at 100,000 a year unless there's evidence that they're actually going to do some good?
Speaking which, here's a job being advertised for an equality, diversity and inclusion champion for the Women's Health Network in the Welsh NHS.
They do not need to be subject matter experts, but will need to demonstrate they have experience in leading the system and organisational/service change, essential, appropriate professional registration, understanding national guidance, good understanding of the principles of clinical governance, blah, blah, blah. How much of the NHS's budget do you think would be reasonable to pay for that person's post?
I think nothing, I have to be honest. I think it's just, it's Mickey Mouse to think that someone can come and change it.
How much do you think the NHS have advertised this post for? How much is the salary?
I would have thought between 50 and 100,000, maybe even over 100.
You're a little stingy. It goes up to 139,882 pounds a year.
Okay. So we get 3 or 4 nurses, 3.5 nurses. You could get, 6 healthcare assistants. Okay.